The ultimate disease would then require me to be put on a donor list for getting a new liver. My name is Ron Guido. I'm retired, but I spent most of my career in the healthcare field working in medical technology and sales and marketing. So my medical journey started with a routine visit to the gastroenterologist, my local doctor, and surprisingly he said that it appears that I have a serious fatty liver disease, and it's called non-alcoholic fatty liver disease, which totally caught me by surprise. I don't drink at all, never used illegal drugs, and my diet wasn't the best, but I do exercise, so I was surprised by these results. And he wanted to move forward to do a biopsy because the ultimate disease would then require me to be put on a donor list for getting a new liver. I started doing some research, got my daughter involved doing it, and she came across Dr. Garcia and his biomagnetism therapy. My granddaughter had Lyme disease, and Dr. Garcia played a big role in purging Lyme disease from this 7-year-old little girl. When I met Dr. Garcia, I was probably like many of his other patients. I had this skeptical look on my face, and I thought, well, you're going to place magnets on parts of my liver externally, and it's going to make me feel better, and it's going to heal what's inside. I just didn't believe it. And he smiled and said, trust me, you'll see, you'll see. And he was absolutely correct. And I'm glad I stayed with it for over a year of therapy. So a year later, I went back and got another liver scan, and instead of being knocking on the door of cirrhosis, essentially as a result of biomagnet therapy and my own use of magnets at home, that risk was cut in half, to the point where this morning I had what may be called my final ultrasound test, and the doctor's words exactly were, you don't have liver disease. I'm 72 years old, but my liver health is probably that of a teenager.